So the fourth myth, that it's not possible to perform scientific studies on religion and spirituality. People think that all the discussion on science and spirituality are just blind faith, that it's not possible to science to investigate it. However, science can investigate anything that can have some kind of empirical implications. And science and spirituality can have implications in beliefs, in behavior, in brain activation. And also, we can correlate these we can correlate these markers of religious and scientific religious and spiritual activity. We can correlate them with any other data, like health, outcomes, mortality, beliefs, and so on. But so now, in these two books, these two handbooks that were edited by Koenig and other authors, he performed a systematic review of the scientific literature in religion and health produced during 20th and 21st century. And he found more than 3,300 studies on science in religion and health, and spirituality, religion, and health. So this is very interesting. So there are more than 3,000 empirical studies published in scientific literature regarding science, spirituality, religion, and health. So it's possible to perform more than 3,000 studies on that. We need to know more about this. And the last myth, the fifth myth, the idea that there is an opposition between medicine and religion, that there has been always an opposition. I usually say that perhaps the world's oldest profession is a different one. Perhaps it's the shaman. The shaman are prevalent, widespread in all old traditions, in all old societies. And the shamans are a kind of mix of priest and physician. So since the beginning, the healing practices and the spiritual practice has been connected. And throughout history, these connections has happened in many different situations. For example, the hospitals, as we know nowadays. The hospitals were created based in the Middle Ages by religious communities, basically the Catholic Church and the Muslims. They created the first hospitals in the Middle Ages to take care of sick people. In Brazil, 1/3 of hospitals are run by religious organizations. And also there are several examples throughout the world of religion supporting or promoting health care. In Brazil also we have a very interesting example of this, a very important example. Catholic Church has in Brazil the Children's Pastoral Care. The Children's Pastoral Care follows up millions of poor mothers and poor young children, promoting health with them. Basically health education, helping them in nutrition, in how to deal with common children's disease. And there are several studies shown that the childhood mortality is decreased in the hundreds of regions where the children's pastoral care are working. Another example, there are some studies shown between 30 to 70% of health institutions in Africa are directed by religious organizations. Another point of showing these connections, there are several studies, for example, in Brazil and the United States and in other places, showing that most patients wish that the health professionals approach their religion and spirituality in healthcare. And also studies showing that a lot of patients, usually most of patients, use religion and spirituality to cope with illness and stressful events. And most studies also have shown throughout the world that most of humanity holds some kind of spiritual belief. For example, the World Value Survey that's performed throughout the world I'm showing here some of the most populous countries in the world, that people have a soul. So most people in the world believe that people have a soul and there is life after death. Two of the major ideas of the most common spiritual tradition throughout the world. So, so if most of humanity holds some kind of spiritual belief, if they think that this is important, and also there are evidence based on that 3,000 studies that religion and spirituality is usually associated with less depression, lower suicide rates, lower rates of alcohol and other drug use and abuse. And also higher levels of religious involvement is related to better quality of life, optimism, and lower depression levels. However, there are negative aspects of spirituality that also can be related to worse health outcomes. And to finish this idea about the relationship between medicine and healthcare and religion, there are explicit recommendations to integrate religion and spirituality in healthcare promoted by different health organizations, like the American College of Physicians, American Medical Association, World Health Organization, and even the Joint Commission on Accreditation of Healthcare Organizations, the most important accreditation organization regarding hospitals and healthcare, also requires that religion and spirituality should be taken in consideration by health professionals. And also, there are several sessions dedicated to the study of religion and spirituality at the Royal College of Psychiatry in the UK, at the American Psychiatric Association, at the Brazilian Psychiatric Association, at the World Psychiatric Association, and also at the American Psychological Association. All of these organizations have sections dedicated to the study of spirituality and health.